पूर्ववैद्याय नमोऽस्तु तस्मै.
Welcome to Ayurprabha. Today we are going to discuss a topic in Kaya chikitsa. So already we have discussed two diseases among the reservoir diseases, that is Roga and Roga. There we are discussing in detail about nidhana pachanga and its chikitsa separately. So today we are going to discuss about the disease Amavada. It is coming under reservoir diseases. So in the disease Amavada is not mentioned in Brihat race. So we can come across the references about Amavada in Madhava Nidhana and Yoga Ratnakara. So today I am going to discuss about Amavata Nidhana Panchaka on the basis of Madhava Nidhana and the chikitsa part as per Yoga Ratnakara. So we will go. First one is Nidhana and Samprapti. So nidhana, it is a viruddha ahara cheshta. Due to a incompatible intaking of a incompatible food, so already the person is a mandagni, then next nidhana is snigdham bhuktavado hyanam vyayamam. After indulging the fatty food or after indulging the sneha ahara, the person is indulging in a vyayama, physical exercises. Then, so because of these nidhanas, what will happen? There is a formation of ama in the bodies, because he is, as soon as intaking of a snigdahara, he is going to indulging in vyayama karma. So due to viruddhahara, so due to this all the nidhanas going to form ama in the body. So this ama, it will propel out the vata dosha from the body. It will, this ama and vata dosha is going to locate in the shleshmasthana, in the kafasthana. So after locating in kafasthana, there is with the ama. Ama is already, it is undigested. This undigested ama is going to again vidagdha. So after getting vidagdha avastha, this ama dosha is going to vitiate all the doshas, irrespective of vada, pitta and kapha. This ama is going to vitiate vada, pitta, kapha doshida. So after vitiation of doshas, it is going to circulate all over the body through dhamanis. Dhamani pratibadhyate. Okay, then this one will cause obstruction of the srodasas, srodasam abhishandi. This will cause the obstruction of the srodasas, and there is a formation of the adhipichilada. This content is getting adhipichilada, more sliminess. So due to these reasons, due to this nidhanas, due to in the body, there is a manifestation of lakshanas. Like there is a daurbalyada, gauravada, the patient will feel weakness and heaviness in the chest region, in the hridaya pradesha, and also this vitiated ama along with the vitiated doshas is going to located in the trigasandhis, in the sandhis. So in the sandhi there will be an stabdada. We can find this. Okay. Dosha involved is vada, pitta and kapha. All the doshas are involved, vitiated here. Then dosha is all the dhadus. From the dhadus are involved here. Next Agni is Jadaragni Mandya, as well as Dhadu Agni Mandya is there. Ama, due to Jadaragni Janya and Dhadu Agni Janya, Ama will be there. Then Udbhavasthana. Here Amasha is Udbhavasthana. We can see vitiated ama and Vata dosha is going to locate in the Shleshmasthana. So here Udbhavasthana is Amashaya. So Shleshmasthana here the Udbhavasthana is Amashaya. Next Sancharasthana. There Dhamani is Sancharasthana. After getting the vitiation of all the doshas, that vitiated doshas and ama is going to circulate throughout the body through dhamanis. So here the sancharasthana is dhamani and adhisthana. Here kafasthana, the Madhavankara is specifically telling is ama is getting to locate in the shleshmasthana. So here adhisthana is shleshmasthana as well as sandhi. Next Roga Marga. Here the Roga Marga is Bahya Roga Marga as well as Abhyantara Roga Marga. Both margas are involved here. So Shrodasas, all the Shrodasas are affected. One Lakshana of Amavada. First one is Angamarada. The patient will feel generalized body pain and aruchi. He will experience anorexia or a distress, trishna. There will be excessive thirst and Gauravada, heaviness in the body, Jwara, there is a generalized temperature, rising temperature, or there will be a Jwara, fever will be there. And Apaka, the digestion of the person is affected. Next, Shunada Angana, there is a swelling in the body. Next, so these all are the Samani Lakshanas. Next, we are moving to the other features. So we first we can see is Rujyade Athyartam Vyavita Iva Vrishchigehi. The patient will feel the Vrishchigavat Vedana. That is, the pain is like being beaten by a scorpion. Utsahayina, he is unenthusiastic. Next, Vairasya, there is an anorexia or there is an distaste in the mouth. Then Daha, body burning sensation will be the Bahumutrada. Bahumutrada, the polyuria or the person is having a tendency to pass the urine frequently. So we can see this all the lakshanas here. We can see that there is a systemic involvement is there. So all the shrodases are involved. All the system is involved here. The next is on the examination. We can find that Kukshav, Kadina and Shula. There is a pain and there is a Kadinatha in the Kutshi Pradesha in the abdominal region, and there is interrogating with the patient. We can see that we can find that there is an imbalance in their normal sleeping pattern. Okay, and there is an other lakshanas like there will be an trishna and Chardi will be there, and Brahma will be there, giddiness will be there, Murcha will be there, and Hridroga. That means there is some kind of a discomfort in the Hridaya Pradesha or in this region, and Vrit Vibandha. There is some constipation will be there, Andhra Kuchana. There will be some type of a sound can hear from the abdomen. So here, and Anaha also will be there. So we know, we already seen in the Samprapti that the Ama, the vitiated Ama or the Dosha is going to locate in the Shleshmasthana. Due to that, there is some kind of pathology is going to happen in the abdomen. So due to that, we can find some lakshanas like Kukshi Kadinada and Shula. There is a pain and Andhra Kuchana, Anaha, Androl. So here, all the systems is involved. The systemic lakshanas can be seen. So lakshanas. So if a Pitta is a dominant, then we can find Daha and Raga in the part. That is Daha, there is a burning sensation and there is some kind of a redness or a tenderness we can see in the affected part. Next is if Vata dosha is involved, there is a pain, there is a Shula will be there. Then if Kapha is involved, we can find that Stimida is being covered with some kind of a wet cloth or like that feeling. And Gurudha will be there, Gaurava will be there, heaviness will be there, Khando, there is an itching in the body. So these are the Vishesha Lakshanas based on the doshas. Then if the only one dosha is involved, then Amavada is Sadhya Roga, it can be curable. If two doshas are involved or two doshas are vitiated, then the Amavada is Yapya. It is only manageable. Then if Tridoshacha, all the doshas involved is Sadeha Charat Shrotaha. If we are finding a Shota all over the body, swelling all over the body, then the disease is Asadhya, not be cured. Next we will move to the chikitsa. For chikitsa, Langana is the first line of treatment, Svedana. Then Tikta Rasa and Kadu Rasa is helpful here, and Dibana should be done. Virechana Karma, Snehapana, Basti. These all are the line of a treatment for Amavada, and various types of a Svedana is also prescribed here. especially Ruksha Sweda is indicated. Okay, here Ruksha Sweda is in the form of a Valuka Sweda, Valuka Potli Sweda, or Banana Sweda is indicated. Here he is telling Sneha Vivarjadaha. So the Sneha externally applying a Sneha is a contraindicated here. So here he is telling Ruksha Sweda should be administered and Sneha Vivarjadaha. Externally we cannot apply the Sneha Dravyas. Okay, but for Sneha Pana is indicated, but Sneha application is contraindicated here. So we can see first line Lengana. Lengana is indicated in Amavasta. If the doshas are in Amavasta, then we can go to the Lengana. Then next is the doshas in the Sanchaya Avastha, then we can adopt a Svedana. The various Svedana method is here prescribed. First is we can go with a Valuka Sveda, Valuka Potli Sveda or Banaha Sveda. So here Ruksha kind of a Sveda is indicated. Then Nidhana is indicated in Agni Mandya. Then Virechana and Basti in the Nirama Avastha. If in the doshas are in the Nirama Avastha, then we can go to the Virechana and Basti Karma. Prior to the Virechana and Basti, we have to administrate the Sneha Pana. If we are applying a Vadahara Taila in Amavasta, it is going to increase a pain and a swelling. If we are applying in the Nirama Avastha, the pain and the swelling is going to reduce. If the ama is got rid of, then we have to go with the Kaphavadahara Tailas. So in Kaphavadahara Taila, in Taila, because of a Sneha Guna, it is going to reduce Vada Dosha, and because of the Ushna Guna, it is going to reduce Kapha Dosha. Next, Yoga Ratnakara is telling how the wild elephant are controlled by the lion in the forest. In the same way, the errand Sneha is going to subside the Amavata. Based on the different avastas, the medicines also will differ. So generally we can say that Simhanada Gugulu, Mahayogaraja Gugulu, Harasnadi Kashayam, it is a reference from Sahasra Yoga, Rasana Panchana Kashayam also from Sahasra Yoga, then Ajamoda Dichurna, also these are some of the formulations for the Amavata.